The Democratic Nursing Organization of South Africa is calling on, in Gauteng rather, is calling for the provincial health departments, acting HOD and the CFO to resign immediately. We're joined by Simphiwe Gada, DENOSA provincial chair, to tell us why. A very good afternoon to you, sir.
Afternoon. Thank you for inviting us.
And why are you calling for these resignations?
Well, the two individuals that were asking for their resignations is simply because they do not respect organized labor. They do not respect, meetings that we take with them. For instance, on the 16th of March, we had a very lengthy meeting with them where we resolved that they should progress the community service nurses. And we all agreed and we parted ways with the understanding that these nurses would be taken in. Then on the 30th, which was on the eve of their last day, we then hear through the grapevine they don't even have the audacity to inform us that they are changing the decision, of which they do not have the authority to change that decision. So we view them in a way that they do not respect workers. They've got no interest of the Department of Health, because how do you then not implement that decision, whereas it is very evident that we do need these post-community service nurses. But also they are undermined of thinking that they are doing unions a favor is something which we frown upon. We are recognized by law. We exist in terms of the law, and they should respect that. And also, the issue of the unpaid medical waste is also one of the reasons, the challenges that were there at Barra. We are saying that all these challenges have got to be addressed, and they will require people who are committed to servicing the citizens of Gauteng. And these two have clearly demonstrated that they are not, committed to respecting stakeholders and to implementing decisions that are taken in meetings. That is why we are calling upon them.
Yesterday, the call was that they resigned by the end of the day. Have they resigned?
One of them has already left the HOD, who, by the way, was seconded from the Office of the Minister of Health, has left the Department of Health. We are now going to ensure that we intensify our call for the CFO to go, because she's not assisting the discourse of health in the province.
What were some of the reasons given to you, especially when it comes to these posts on community service nurses? We received some reports that says out of 954, it's been reported that only 601 had available funding.
Yeah, these are some of the reasons why we are calling that the CFO should go, because the compensation of employees' budget is ring-fenced. Now, whoever then moves that money and shifts it around either for goods and services or for whatever is doing, a financial malpractice. So this is why we're saying that how do you then take money that is budgeted for, and the posts are existing in the system which show that they are vacant, they are funded, and then you tell us that out of the 957 that was identified, only 601 has got funds. You then make a U-turn and you say you don't have the money for the 601, and yet you are a CFO, you are also an HOD. So they've got to account as to what happened to the funds of this 601, and why are they not prioritizing that at the available posts, we then are able to progress these post-community service nurses. But also, the other issue that we want to raise is the fact that the department between September last year and December was in a better position to could have planned for these post-community service nurses, but they decided to not plan because there's evidence of a task team that we formulated that tells us that posts were available. So we are dealing with a self-created crisis here, and that is why we are saying that if we are led by people who then create a crisis, it's not going to assist us moving forward.
You indicated yesterday that should your demands not being met, one down, one to go, you will be meeting with organized labor for a shutdown of the Gauteng Health Department head office until your demands are met. What next?
Well, we are in the process of meeting the organized labor, and we are also appealing for the public to also have sympathy with us on this one, and want to promise the public that their right to access healthcare will not be affected. That is why we are saying we'll shut down the Department of Health, because that is not a clinical establishment. And the hospitals must run, because who we are fighting here It's not the public, but it's those who are failing us in terms of administration and leading the Department of Health. So we are in the process of that. We'll be making announcements together with other organized labor to say what is our course of action.
And just for your benefit and the benefit of our viewers, we have exhausted attempts to get the Gauteng Health Department officials for a right to reply, and by the time of going on air, they were still not available, or at least did not respond. Simphiwe Gada, DENOSA Provincial Chair. Thank you.